All right, hello and welcome to the Corner Booth. Today's topic is the puzzle of women's health, how race, class, and gender intersect in Texas. And before we get started, I just wanted to extend a gracious thank you to Dr. Inkster and the Elizabeth D. Rockwell Center at the Hobby School of Public Affairs. We are going to get started in just a moment, but just as a reminder, we do have questions prepared in advance that we'll go through first. And then at the end, we will open it up to Q&A, and you are welcome to either just raise your hand at the end or drop your questions or thoughts in the chat.
All right, so before we get started, we just want to introduce our wonderful host, Kristen Ylana. She was born in San Antonio, but spent her childhood in the heart of the Hill Country. Growing up in rural Texas taught her to appreciate the little things in life, find beauty in nature, and nurtured her sense of adventure. She moved to Austin to attend the University of Texas at Austin, where she studied public relations and Mexican-American policy studies with a focus on the intersection of race and health policy. Kristen fell in love with Texas politics and policymaking during the 83rd legislative session. Following her passions, she left the Capitol to work at the Health and Human Services Commission with the Women's Health and Education Services Division. She currently serves as Joint Chief of Staff for the Representative Donna Howard and is the Executive Director of the Texas Women's Health Caucus. The Texas Women's Health Caucus is a bipartisan caucus that seeks to promote women's health care and access and to educate legislators on women's health care issues and the need and cost-saving benefits of these services. Kristen hopes to continue to dedicate her life to public service and do her part to create a more equitable and just future for all Texans. When she is not working, Kristen enjoys spending her time with her 3 dogs, Professor, Pantera, and Willie, I love those names, watching the Great British Bake Off, cooking, and working in her garden. Kristen, we're so excited to have you here today, and thank you so much for taking the time to meet with us.
No, of course. Thank y'all so much for having me. I'm still getting used to public speaking after a pandemic when, I feel like everybody was like, let's not add that to people's plates. But thank y'all again for having me. I really appreciate the opportunity. It's definitely an issue that has been an important part of my life for a really long time. So any chance that I get to talk about women's health and policy, I will always take. So thank y'all.
Great. So to kind of kick us off, can you tell us about some of the systemic and social issues of disproportionality in health and healthcare facing Texas women? And given the way that these issues are intertwined, where should policy begin on the path to alleviating these disproportionalities?
Yeah, I will say all of y'all's questions are wonderful. There's so much to unpack. And I know I'm not going to do any one of them justice because there is just so much in it. But working at the Capitol and in women's health, the first thing that comes to mind when we talk about this issue is maternal mortality and morbidity. It's been such a big issue since 2013 when we established the Maternal Mortality and Morbidity Task Force at DSHS. And they've been invaluable, the information that they give to the legislature. But I think with their data and with the things that they've been doing, they've really highlighted gaping holes in our healthcare system throughout the state. The reality is that Texas has one of the highest levels of maternal mortality and morbidity in like the world, which is absolutely mind-boggling considering we're in Texas, right? Like we are outpacing other countries that do not have as robust of a healthcare system that we do, right? That don't have major metropolitan areas with investments and things like that. And so I think in that sense, it's just, I know it seems like the easy answer to go to with this kind of question because it's so top of mind, but it's just something that it blows my mind every session that, we established this committee in 2013 because we recognized a problem. And it took until last year for us to do anything really about it. And even then, the committee's #1 recommendation was for us to extend Medicaid for postpartum or pregnant women's Medicaid postpartum to a full year after, because we know that a lot of these problems and a lot of these health issues arise 6 months to even a year and a half post-birth, right? So Representative Rose, she's one of our caucus members. She led that effort, introduced a bill that would have extended it to the full year. My boss works on the appropriations committee, and so does Chair Rose. They worked together, figured out that there was the money for it. But at the end of the day, because politics is what politics is, we only extended it to 6 months, which meant that we really only got an extra 4 months when the recommendation was a full 12 months. And I think that that's just indicative of how long it takes us to solve these issues and to get to the point where we recognize a problem, and we can recognize a problem tomorrow, but that does not mean that we're going to do anything about it, which can be incredibly frustrating. I think outside of maternal mortality and morbidity, if you look across every healthcare disparity, we lead the nation in them. We have the highest rate of uninsured people in the US. We have 5 million uninsured people. So 1 in 5 Texans is either uninsured or underinsured. It's unacceptable. At this rate, even if we were to expand Medicaid, which we know would make us money, we would still have over 3 million people without health insurance. And when you have issues to access how you're going to pay for care, then it's not surprising that we lead the nation in chronic diseases. It's not surprising that we have the highest rates of suicide in the country because we don't have adequate mental health services. It's not surprising that substance abuse disorders continue to just run rampant across our communities. And so going back to the second part of your question about policy, I think there are a lot of ways and there are a lot of issues where the legislature is divided. But there are some places where we agree that there's work that needs to be done. And I think we can find common ground on it. We just have to work on, messaging. As somebody with a comms background, a lot of what I do is figuring out how to message these problems. Because if you talk to Republican staffers and you tell them, mothers are dying at a higher rate than anywhere else in the country, people are dying of completely preventable diseases than anywhere else in the country, which impacts every aspect of Texas communities. It impacts our economy, it impacts our school systems, it impacts our workforce. We can all agree that these are problems that need to be solved. But if you tell them that the solution to that problem is to expand Medicaid, well, that's a complete non-starter for them because they have talking points against it, right? But if you say, well, we're going to increase access to healthcare by figuring out ways to message to communities and make it more affordable, well, all of a sudden everybody's on board. And so I think when it comes to policy solutions, we really have to, as healthcare policymakers, figure out ways that we can message the solutions that we're trying to pass and bring it back to the human side of the issue. I think oftentimes we get really scared about the dollar price, and I get it. It is a big thing. When a fiscal note comes out on your bill, it's probably my worst nightmare. I live in fear of the LBV finding a fiscal note on any of my bills, but we have to spend money. We just do. And when we're talking about a state that has $293 billion to spend in our biannual budgets. We have a rainy day fund that is one of the largest in the country. We have the money and we have the resources. We have to figure out ways to find revenue streams to fund it. And so it just goes back to figuring out, again, messaging on it and finding creative solutions to address the money piece of it, because we also don't want to just put everything with a dedicated revenue stream and say, okay, well, that's going to be done. We're going to collect fees on an increase in driver's licenses, and that's how we're going to fund Medicaid. We can't do that, right? We have to find and be innovative about how we're spending our state's dollars and how we're being responsible stewards of taxpayer dollars. So I don't know if that answers your full question, and I can go into other details, but
it definitely does. I know that individual question alone could probably take up the floor. So I appreciate you hitting the high points in a way that gives us a strong enough overview. I also shout out to both you and Kate for this. So it is very clear how in alignment y'all were in your work together, because these are a lot of talking points that we've got to hear her bring up in class before. So it's exciting to hear them echoed.
Kate wrote them, so
well,
I'm still
great.
going
Okay.
off the documents that Kate wrote, so it's great.
All right, so the second question we want to discuss is another concern for Texas women is around domestic and sexual violence. Can you speak to the ways these issues connect to larger patterns of inequity and privilege? And if education is the answer or part of the answer, how can policy specifically target these disproportionate impacts?
Yeah, definitely. Another question with so much to unpack around it. But when talking about these issues, I always try to ground the conversation in the experiences of survivors. Every survivor's experience and story is different. How they decide that they're going to respond to it is different. Their pathway to healing and justice is going to be different. And a lot of it is going to be dependent upon the support services that they have immediately available to them. In Texas, according to the Institute of Domestic Violence and Sexual Assault at UT, 9% of survivors report to law enforcement what happened to them. Of that 9%, only 3% of cases lead to prosecution. It's astounding. I mean, that means over 90% of survivors do not seek justice or healing through law enforcement. When you have a number that large and a population that large, we have to ask ourselves why. And I think, there are so many reasons why I think access to sane nurses is something that we talk about a lot. There are large swaths of rural Texas that don't have a sane nurse, or they have one sane nurse that is in charge of 3 or 4 counties, which in rural Texas can mean they're in charge of a 6 to 8 hour radius area, which is impossible for one person to do, right? That means that you have a sane nurse in your hospital once a week. Well, if I get assaulted on a Monday and my sane nurse isn't going to be here until Thursday, that's too much time, right? So we have to increase access to sane nurses. We have to increase access to these healthcare services, to safe, ready facilities, all of the healthcare side of it is something definitely that we need to address. But when it comes to the law enforcement side, something we don't want to talk about necessarily is that there is a systemic problem with racism in policing. And we know that. And we know that problem and that serves as a barrier to people wanting to go to report. If you think already that when you go to report, you're not going to be believed, if you think that there could be a possibility that they're going to use your evidence against you because it's happened, or that you're going to be seen as the criminal, or in some way it's going to be misconstrued against you, you're probably not going to go report it, which means that your offender is going to continue to live out in the community. You're going to continue to live in fear of, encountering this person again and the trauma that comes with that. I will say, all of that being said, I do think that Texas is at the forefront of sexual assault policy reform. Shameless plug for my boss. I think she's incredible. But one of the bills that she passed a couple of sessions ago created the Sexual Assault Survivors Task Force, which is one of the first task force of its kind in the United States. It's a task force made up of all pieces of this puzzle. So law enforcement is represented, higher education is represented, sane nurses are represented, and of course survivors are represented. They meet regularly during the first 2 years of their work. They provided the legislature with 11 recommendations that were survivor-centered to revolutionize the way that we address sexual assault policy. They provided over 150 recommendations to local law enforcement. They've updated the training. They've updated the information that goes out to survivors. They've updated the training that goes out to sane nurses. And all of these things are incredibly important because it's the first time, at least to my knowledge, that we are centering survivors but we're also working in tandem with them to create solutions. So we're figuring out the ways that we can ensure that that 9% goes up to 90% of survivors have access to the justice system and have access to the resources that they need to heal. But going back to what we were talking about earlier, I think as I love the SASTF, I think they do great work. I'm really looking forward to reading their report in a couple of months. And we were successful in passing all 11 of their recommendations. They're seen as a group here in the building that regardless of party, regardless of where you come from, you trust them. So I'm confident that we'll be able to do that again, regardless of how many recommendations they have. But the reality is we can do great work in this building. We can make wonderful laws that increase access, that provide the programs and do all of these things. But at least with this, if survivors and if the community doesn't trust the system, if they don't feel like these will act like this is real and that this is real change, they're not going to take advantage of them. And so we do have to go back to the education piece of it. And we have to start finding ways to bring communities of color together with police to increase trust and to rebuild those broken bridges. Because if we don't do that, I can pass the best law in the world. I can provide billions of dollars to sexual assault, but it's going to go unused because people aren't going to trust who they have to go report to, right? So we've got to find ways to build those bridges. Again, I know that was very long-winded.
No, yeah, it was great. Yeah, so speaking of building bridges, as aspiring policymakers, we are aware that bipartisan support is crucial for moving any proposed policy forward. Can you talk about the ways that your organization reaches out to members on both sides of the aisle to benefit those women who are most vulnerable in the state of Texas?
Yeah, I am super proud that we are a bipartisan caucus. We have one Republican member, and that's okay. But I think it's great. I mean, it was a fun story. I think Kate was in the office at the time, but we were collecting our dues, and we got a call from Chairman Murphy's office. So he's the GOP caucus chair in the House. His staff said, "Oh, your boss, have your boss go up to mine and he'll give you his dues check." So Rep. Howard goes up to him and it's like, "Wow, Chairman Murphy, you're going to join our caucus? You join the Women's Health Caucus?" And he was like, "No, I don't think I'm actually going to do that. You must have the wrong person." And she was like, "Oh, okay." Comes back to the office. She told me, she's like, "Why did you tell me to go to Murphy? He is not part of our caucus." And so I called and I was like, "Hey, we tried. What's going on?" And so his female staff told him, "Oh, wait, no, you are joining this caucus because you have all female staff and our health is important. And it's important to us that you join this caucus." So he came up to my boss the next day. He was like, "I'm so sorry, I was mistaken. Here is a dues check and I'm a part of your caucus." He asked respectfully to not be part of the abortion bills. And we were like, "Understood." But he understood that there were places where we needed to partner. And so we went to him when we were trying to, organize amendments. We went to him to ask him if he could ask questions on the back mic and a lot of this is behind the scenes. So he has to be like behind the scenes supportive and work with his partners, because sometimes I don't necessarily need you to vote for my bill, but I need you to not advocate against it, right? We were on an IT caucus tour a few weeks ago, and Chairman Capriglione was like, "Yeah, I passed like 3 bipartisan bills this session." And I probably spoke out of turn, but I turned to Rep. Howard and I was like, "Well, all of your bills are bipartisan, Rep. Howard." And she was like, "What do you mean?" I was like, "You have 100% bipartisan rate in terms of like your bills passing." And she like looked at me kind of puzzled. And I was like, "You have to. We're in the minority. Like I cannot pass a bill without you, right?" And so if you look at, our legislative agenda and you look at the legislative agenda of the members of our caucus who were successful in passing their bills, they had to have bipartisan support on both sides of the legislature, right? And so it's clear that there are places where we can come together. There are places where we can build coalitions. But again, it goes back to messaging. We have to, it's something we talk about all the time in our office. We as Democrats have to be better about messaging what our ideas are. We have to be better about telling them that even though, yes, this is coming from Rep. Howard, who is a progressive Democrat during campaign season, that doesn't mean that this is going to completely upend the conservative movement, right? And so just figuring out where those unicorns of bipartisanship are, like latching onto them and figuring out how we can just advance them and just run with them is probably 95% of what I do during session. And then we have to, I think, too, be creative on our end. We, I think, are an incredibly successful office simply because Rep. Howard is not afraid of not having her name on the bill. She doesn't have to. We are great at looking at writers. We will get our bill onto an amendment on your bill. And so, we try to find every vehicle that we can to amend our bills onto, knowing full well that if it passes and, becomes law, her name is not going to be associated with it necessarily, right? Because it's going to be under somebody else's bill. But that's okay. At the end of the day, what's important is that this policy passes and that the people that we sought to help are helped, right? So she doesn't care about whose name is on the bill, right? And so at the end of the day, it's about putting aside our egos and realizing that sometimes she's also great at realizing that she's not always the best person to be talking about these issues. We just had our legislative retreat. We were going through everything that we want to look at for this coming session. And one of the things that we were talking about, she was like, I don't think I'm the best person to carry that. I think we need to pass it to a Republican and like it might get passed. And it's a bill that she's been working on for 2 or 3 sessions now, but not being afraid to reach out to an ally or to have an unlikely ally, I think is something that we really need to embrace if we're going to advance any of these policies. If we're going to create the state that we want to create, we have to be innovative and we have to find, we just have to find unlikely allies and be fine with that. I will never forget that 2706, our sexual assault omnibus bill, passed unanimously from the Texas House because Tony Tinderholt gave a glowing endorsement of the bill from the back mic. Tony Tinderholt, one of the most conservative members in the Texas House, went up to the back mic and was like, everybody in this room needs to vote for Representative Howard's bill. It's a great bill. Do it now. He was like, if you don't want to vote for it, I will vote for it for you. And we were like, please don't say that. That's like a point of order. But his endorsement helped us. And we got out of the House unanimously and we flew through the Senate and it was a unanimous bill. And Rep. Howard thanked him publicly, was like, thank you so much, Tony. It was wonderful. So just working across the aisle and not being afraid to make friends.
That story is really, it doesn't make the media when policy is in alignment. So I love hearing those stories. It does give me a lot of hope that there is like more progress happening at the policy level than we probably hear about just from the regular news. Okay, so next question. Texas's legislator made international news this past summer with the passage of SB 8, the so-called heartbeat bill. Now we are seeing equally oppressive laws and bills pop up in regards to reproductive health all over the United States, not to mention rumors of the Supreme Court overturning Roe v. Wade. What will the impacts of these restrictive laws have, and how will these laws disproportionately impact poor women and women of color?
Oh, this question breaks my heart. SB 8 was probably the worst day in the 10 years that I've worked in the legislature. There have been hard days in the legislature. There have been days where I watch what's happening on the floor and I am just beside myself with disgust at what's happening and with what's being said. But Senate Bill 8 was one that just stood apart from the rest. I think in part because there were members on, and Kate knows this, there are members coming up to my boss and the other members of the Women's Health Caucus on the day that the bill was going to be on the floor. And keep in mind, we do not have control over what goes on the floor. We are not in the majority. Asking her and asking them if there was a fix for it, if we had, I don't know, some secret plan to, keep it from passing. I'm surprised we didn't. And they knew that they had to vote for it because otherwise they'd be primaried. And in some ways they were right. I mean, the author of Senate Bill 4, which restricted medication abortions, is being primaried right now, is in a runoff because she wasn't conservative enough. The woman who stood up there as a nurse and denied medicine and said that these were dangerous medications, that these were dangerous things flooding the market, and that there is some large portion of people that are being coerced into taking these medications, is being attacked for not being conservative enough, because her bill wouldn't have put on death row the woman who sought the abortion in the first place. And it's disheartening that that's where this is the point we've come to, because I do think that this issue in particular is one that we know we're going to disagree on, but it overshadows everything else in women's health. It overshadows everything else that we need to be doing. We had a meeting this morning with a pharmaceutical company that has all these great innovative drugs to treat different parts of women's health. And one of the things we had to tell them, we're like, well, make sure you check your ingredients list, because we know that some of these ingredients that are used in medication abortions, because they're used in the medication abortion pill, are completely banned, right? Even though they're being used to treat hemorrhages after pregnancy, right? And so the collateral damage of these bills is, I think, the portion of it that is just the most frustrating, because we told them time and time again, if you pass this bill, let's agree to disagree on abortion. Put that aside. You are limiting people's ability to access the healthcare they need when they want to carry their pregnancies to term. We heard from multiple doctors in ACOG that if these bills passed, which they did, doctors would be forced to wait until women were dying in order to treat, because that was the only exception in the bill. The only exception is a medical emergency in which you're about to die, like you were 30 seconds away from death, and the only way to save you is an abortion. That's the only way that you can seek abortion care in Texas after 6 months. Why are we waiting until people die to treat them when there is a perfectly safe, but it's considered best practices, everybody else is doing it? And there's no reason. When you ask them, the only thing they go back to is, well, it's abortion. And so I think with, the impacts will be that the reality is people with means, people with access to resources will always have access to the healthcare that they want. We've seen that. When you're looking at the health disparities in Texas, it's not health disparities amongst upper middle class or, the top 1% of our state. They're not facing health disparities because they have access to care. If they can't find it in Texas, they can easily go someplace else to do it. The reality is that these bills impact the most vulnerable people in our society, the people that don't have access to monetary resources, the people that have to work and don't have a job that offers them paid sick leave, or already have children and they don't have access to affordable health care, or they don't have a car, so they cannot drive 10 hours to Arizona or wherever they're supposed to go, or they live in the valley and are documented, and driving 10 hours means they have to go through multiple checkpoints and risk being deported in order to seek healthcare. And I hear probably every day, if not every week, from multiple advocates telling us of the stories of people that come to seek care, are unable to, and don't have any other options, which means that they're going to carry this pregnancy that is unwanted to term. And they have valid reasons. Every reason for an abortion is valid. You have mothers who have come and have said, I don't have the money to have a child right now. I just don't. I'm going through school. I have multiple children already, whatever the case may be, but they have to bring this child into the world, and they have two options. They keep it, knowing full well that they don't have the resources to provide for it, knowing full well that they may or may not get access to the care that they need, or they give it up for adoption, right? Because that's what everybody says. Well, you can always give up your child for adoption. Well, let's look at our foster care system. It has been in the courts for 10 years because the courts found 10 years ago that the way that we had set up our foster care system was putting children in harm's way and was unconstitutional. We have not done anything about it. 2 or 3 weeks ago, there was a report out of Bastrop where children had been taken to the refuge and were being sex trafficked. Our foster care system is not an option. If I became pregnant tomorrow, I would never put my child up for adoption here in the state. No, but those are the options that you have, right? I am looking at her life. I mean, there was a story that somebody sent me a couple days ago where, she was understandably upset at what we had done. And she was like, the decisions that y'all've made have essentially just signed my life away. I will forever live in poverty because I have 3 kids that I can't afford already. I'm going to have a 4th. And I'm already struggling to make ends meet. She was saying how, she was on her path to, being financially stable. She had figured it out. And she was like, I got pregnant, found out at 12 weeks, can't do much about it. And everything I had worked to kind of build is now in jeopardy because I have to keep this child. And I don't know what to say to her. We don't have a solution because she's right. We did put her in a position where her options are even more limited than they were before. And these are populations that we'll talk about on the campaign trail. They'll talk about how they want to improve the lives of vulnerable people in Texas, and we want to do all of these wonderful things. And then we come into this building for 140 days and we do the exact opposite. Instead of taking down barriers, we create them. Instead of figuring out ways to overcome these problems that we see and to solve these things, we completely ignore them and we disregard them as being too expensive, even though, again, we have a $298 trillion budget. It is one of the largest in the world. We have the 5th largest economy in the world, and we're saying that we don't have enough money to solve these problems. It doesn't add up. And I mean, we'll see it when we see the numbers of the increase in children in foster care. We'll see it when we see the increase of children without placement. So the children who have to live in state office buildings because there's nowhere else for them to go. We'll see it, unfortunately, in an increase in our maternal mortality and morbidity numbers, because we already know women in Texas die at a higher rate from giving birth than anywhere else. If you force more women who don't have access to care, who aren't going to get the perinatal care that they need or the postpartum care that they need, that number is going to increase. It's undeniable.
So I have a follow-up question to that. Women's health and these issues that you're describing is usually framed as a women's issue alone. And this is something that Whitney and Kate, and we've talked about this before. So how do the issues that your organization is working on affect people of all genders, all races, all classes? In other words, why should non-women care about these issues? And how can we reframe our conversations around them to reflect that? And then we'll open it for Q&A after this question. So we're almost there.
Here, the scary part comes next. It sounds like a basic answer, but it's because we're a community, right? Like every single one of us came from a woman. Like we all have a mother, we all have, we all know a woman, right? And if the success of one person is seen as the success of a community, right? If we say like, oh, we're doing great because this one group of people is doing great, well, then we also have to say that the failures of one or the problems that somebody is experiencing is also an issue in the community, right? We can't just take the successes and claim those as what we want. We have to claim the other side, which means that there are people in our community that are struggling. There are people in our community that don't have access to these things. When it comes to women's health, I mean, one of the first things we did when we took over the caucus with Rep. Howard is expanded our bylaws to include more than just reproductive health, because we know, everybody in this group knows, that women's health is so much more than our uterus, right? And one of the things that we added was increasing access to affordable childcare, because at the end, and affordable housing, because at the end of the day, if I cannot afford the house that I live in, if I cannot find or afford the childcare for my current children, I'm probably not going to be able to go to the doctor, right? Which means that if I have an underlying health condition that is going untreated, I'm probably at some point going to miss work. So I'm not going to be able to go to work, which means I'm not going to make as much on my paycheck. So I might not make our rent. And so the cycle continues, right? And at every point in that process and in that cycle, this person, for the most part, is not alone, right? We aren't living in silos. And so for anybody that wants to say like, well, I'm not a woman and so I don't need to, I'm like, well, you live in a world of women. And so this is your issue. This is not just my issue. That's why our caucus cannot just be women. That wouldn't make sense, because what we do and what we're advocating for is going to affect every single aspect of our community. If a mother is too sick to care for her child, then they might stay home from school more often, right? Which means that they're going to miss out on their school day and on their education. If they can't bring home their portion of the budget, well, the whole family is suffering, right? Like, these are all problems that when one falls, it's a domino effect, and everybody around you is going to feel the effect of it. And so it's just important. One of the things that we try to do is make sure that when we're figuring out who's going to be an amendment author, when we're figuring out who's going to be on the back mic asking questions or even authoring these bills, that it's not just women authoring them. And there's oftentimes a misconception amongst our male members. They're like, no, like, we want to give women the space. Like, we don't want to like impose on them. And we've had to tell them, it's like, yeah, sometimes, yes, give us the space. We are the ones that need to be leading this conversation, but not every conversation has to be exclusively the women of the legislature. And this can't fall on us. And so one of the things that my boss has had to do is go up to the male members of our caucus and say, no, you will be asking these questions on the back mic, because I need to show that this isn't just a women's issue that you can just push aside for another 100 years, that this is an issue that we all have to be a part of and that we all have to work to solve. Because at the end of the day, again, we are a community made up of all kinds of people, not just men and not just women. And we don't have two separate worlds that we live in, because if we did, I would rather live in the woman-run world. I do not live in a woman-run world. So we all have to come together and figure it out. But I know we're running out of time, so I'll be quiet so people can ask me questions if they'd like.
No, it's okay. I didn't want to cut you off. But I really appreciate how there's nuance in getting men to join these issues and understanding what it looks like to be part of it, but not impose yourself into the leadership of it, and understanding like what it means to advocate for without being at the front of. Okay, so now we want to open it to Q&A, and yeah. I know enough of this group to know that y'all are lying if you don't.
You can also drop your question in the chat if you don't want to speak.
I have a question. I didn't want Amanda to take the first question, but if nobody else has anything to ask, I'll go ahead. And maybe I missed this, but with the next Texas Leg session for next year, do you see, with the recent committee charges coming out for the Senate and the House, and from Dan Patrick's office, do you see any potential ways you can wiggle in legislation to improve women's health, or any social determinants of health? And do you see any threats posed by some of the committee charges that were published?
Yeah, I'm an optimist, because one has to be if you want to keep working in this building. So yes, we will be making many changes. No, but I head into session with the idea that every single one of my bills is going to pass and become law, because if you don't have that vision and goal, then the 140 days is going to be unbearable. But in all seriousness, I do think that there is going to be a lot of barriers. Like I mentioned earlier, I've been in this world for about 10 years. And this is the most divided I've ever seen the Texas legislature to be. One of the reasons why I decided to change my career path and embark on this Texas politics and policy one was because I saw great opportunity for bipartisan agreement. There was great opportunity for, bipartisan movements in the House and in the Senate. I mean, back in 2013, Dr. Zerwas, who is a conservative Republican from Fort Bend County, introduced a bill to expand Medicaid, right? And it was part of the reason why I decided to go work for him, because I knew that there was some common sense in that, right? But that being said, I think one of the challenges will be, particularly, we know that come campaign season, and every one of those members is a campaign motivated individual, right? They love to campaign on women's health. I don't know why, but I think every single one of them has put it into their head that they have to put it on a mailer. And so we know it's going to come up. And depending on what happens in June, we really anticipate that the Dobbs ruling is going to significantly roll back, if not completely overturn Roe, which means House Bill 1280, which completely outlaws abortions in Texas and also criminalizes it, will go into effect within 30 days. So abortion will be off the table, but that doesn't mean they're not going to try to legislate on women's health issues, right? And so I do anticipate needing to be prepared for an onslaught of bills that will restrict access to contraceptives. House Bill 835, which was our CHIP contraceptive bill, so would have increased access to contraceptives for enrollees in CHIP with parental consent, would save the state hundreds of thousands of dollars. Did not receive a hearing last session, and if things go the way that I anticipate them to go this summer, I think it's going to be a very hard climb to get to that point. I think another issue affecting the legislature that we're going to see just across the board is the brain drain amongst not only staff, but members themselves. We've lost, decades of institutional knowledge in the legislature on both sides, which means that those seats are going to be filled by freshmen that are coming into Texas politics for the first time, learning about a lot of these issues for the first time. And a lot of them are complex, right? When we talk about Medicaid in and of itself, that requires, I'm barely getting a handle on all of it. And I've been doing this for 8 to 10 years, right? On the staff side, because of the Article 10 veto last session, you saw a number of staff leave. Our legislative director, who is arguably one of the brightest minds in Texas politics, left because it was too much. And so I think one of the things that we're going to have to do, and I think it's an opportunity for us as a caucus, is start educating. And I think what we can do, one of the things that anybody in this room is welcome to come to, at the beginning of a session, I want to do a boot camp where we get staffers, and I'm really hoping, I'm going to try really hard to get some bipartisanship in this boot camp and get Republican staffers to come, but we're just going to take a deep dive into women's health. And so talk about, from just a high level, nonpartisan overview of what do we mean when we say women's health. And I think that that's a really great opportunity for us to try to start breaking this stigma that women's health is just abortion, right? And to start educating people that women's health is more than, it's more than my uterus. It is everything in between, right? And I think if we're able to do that, if we're able to educate staff and members about the wide range of issues and the reasons why this is important, and ground it back to their districts and tell them about their constituents, then we might see some progress on some of these things. We might be able to pass CHIP contraceptives. We might be able to end the tampon tax. We might be able to do these things. In regard to the interim charges are always scary because you never know what they're going to do. But there was a few on alternatives to abortion. I will make it my personal mission to try to not fund that group. But I think with alternatives to abortion, that program that is not a healthcare program, but for some reason is in the Health and Human Services Division or Commission, takes a significant part of the budget. It's $100 million in that healthcare program or in that program. They hand out pamphlets, y'all. Like, we're spending $100 million for pamphlets. And so I think when it comes to like some of these issues, like alternative abortion in particular, they're going to look to expand that program, which is a danger on our end, or in my opinion, because that program will take money away from services that I need in healthcare, right? So we'll see what happens, but I'm hopeful. And I mean, don't let the fact that session is a mountain to climb for everyone. Our legislature and our legislative process was built to kill bills, not to pass them. So you have to go in knowing that.
Yeah. All right. Well, we might have time to squeeze in one more question because I know we didn't. So if there's anybody out there, otherwise we want to respect everyone's time.
I'll also drop my contact information in the chat, and y'all can feel free to ask me questions on this side.
That would be great. You can already expect an email from me about info on this boot camp. I don't know if laymen are allowed to attend, or lay women.
I'm really, oh no, please. I'm really hoping to get this really smart individual, Kate. I don't know if you know her. She should really present at my boot camp, but no, y'all should definitely come. If y'all are in the building, please don't be afraid to stop by and say hi. And if you're interested in working or in joining the Texas Capitol, I know this conversation might have seemed a little bleak, but it really is just the most special place in Texas for me. There is a great sense of purpose and duty in working here. There's also great potential to do wonderful things and to really uplift Texas and to create the world that we all want to live in. The reality is that that world's not going to get created unless we have people that are willing to sacrifice and to be in this building. And Kate can attest to it. It's hard. It is. But the best feeling in the world is when your bill passes and you know that people will benefit from work that you did that will never know that you existed, right? But you helped their lives and you changed their lives in a meaningful way to them. And that is a feeling that you can't get anywhere else. So I know I talked not wonderfully about the legislature, but I really hope everybody here comes and spends some time as a witness, as just watching, as an intern, or as a full-time staffer. It's truly a special experience that I love.
I thought it was extremely insightful for someone that doesn't have a lot of legislative experience, just hearing how all these things work. And of course, your opinions and your work with the caucus was really enlightening to me. So thank you so much for your time. And again, we'd just like to thank Dr. Inkster and the Elizabeth D. Rockwell Center at the Hobby School of Public Affairs. We want to thank you for joining us on all of our corner booth events this year. Whitney and I are both graduating, so we will be passing the torch, and hopefully some of you will be joining the group in the fall when they return with more events. So thank you so much.
Awesome. Thank y'all so much. Don't be a stranger.
Bye.
Thank you.